Hello everyone, today I will be discuss about the blood types. Blood can be classified into two types. One is plasma which contain 55%, another is blood cell which contain the 45%. Plasma about 90 to 90% is water and 7 to 8% is solid. In this solid it contains the plasma protein. Plasma protein examples albumin, globin, fibrinogens. It also contains the amino acid, glucose, fatty acid, hormone, enzyme, nitrogenous waste product, example ammonia, urea, uric acid, etc. It also include the electrolyte, example sodium, calcium, potassium, chloride, magnesium, etc. Then 1% it also include the some gases, example N2O2, CO2. then then blood cell can be further classified into RBC, which called as the erythrocyte, WBC, which called as the leukocyte, and platelet, which called as the thrombocyte. The WBC further classified into the granulocyte and non-granulocyte. Granulocyte further classified into the three types. We can be know by these mnemonics at NAV: neutrophils, which contain 40 to 45%, which is multi-lobe nucleus. There are 3 to 5 nucleus. The neutrophils can be increased in acute inflammation, which produces pus, and it also increases in bacterial infection and fungal infection. Then eosinophils. Eosinophils is also called as the acidophils. It contains 1 to 6% in a bloodstream. It is bilobe nucleus which contains 2 nucleus, and it can be increased in parasitic infection and allergic condition. Then the basophils, it contains about 0 to 2%. It is also a bilobe nucleus which contains 2 nucleus, and it can be increased in hypersensitive allergic condition, for example chickenpox and smallpox. Then the further non-granulocyte. Non-granulocyte can be classified into monocyte. Monocyte is the kidney-shaped nucleus which is 2 to 10%. It can be increased in chronic infection like the tuberculosis. It also further can be transformed into the macrophages and dendritic cell. Then the lymphocyte further can be classified into two types on the basis of size: large lymphocyte and small lymphocyte. And it also can be and the large lymphocyte has large nucleus, less cytoplasma. It is about 15 to 45% in the bloodstream. It can be increased in viral infection and chronic infection. And then this lymphocyte can be further classified into two types on the basis of function: B lymphocyte. The name of B lymphocyte is actually due to at the first time it can be found in bursa of Fabricus, which is the lymphoid organ present near the cloaca in a bird. And this B lymphocyte further classified into memory cell and plasma cell. Plasma cell produce the antibody. Then T lymphocyte. The name of T lymphocyte is due to it can be mature in thymus, so it called as the T lymphocyte. T lymphocyte further classified into the further transform into helper T cell, killer T cell, suppressor cell, and memory T cell. The helper T cell is called as CD4 cell, and killer T cell is called as the CD8 cell. In a normal healthy man, the ratio of CD4 to CD8 is 2:1. But in a HIV/AIDS patient, the retrovirus kill the helper T cell, so the ratio of CD4 CD4 and CD8 can be altered and become 1:2. Thank you everyone for watching the video. Like, comment and share the channel. Thank you everyone.